Assalamualaikum warahmatullahi wabarakatuh. In this video, me and my friends are going to talk about the application of optical fiber in medical. This is my group members, which is me, Hazika Nur Hikmah, Siti Aisyah, and Siti Aimee Sarah.
I'm going to start from the introduction first with a question: what is optical fiber? Optical fiber technology is a method of transmitting data using light pulses. Unlike traditional methods that use electrical signals through metal wires, optical fibers utilize light to carry information over long distances with remarkable efficiency and speed. Optical fibers are typically made from either plastic or glass. These materials are chosen because they effectively transmit light with minimal loss, ensuring data integrity over long distances. Next, one might wonder why we don't just use metal wires for all our communication needs. The reason lies in the advantages that optical fibers offer reduced signal damage. It means optical fibers suffer fewer signal damages compared to metal wires. This makes them more reliable for transmitting data over long distances.
Slide number 2 is about how do fiber optic cable works. Light travels down a fiber optic cable by bouncing repeatedly off the walls. Each tiny photon's particle of light bounces down the pipe like a boost light going down as an ice run. Now, you might expect a beam of light traveling in a clear glass pipe simply to leak out of the edges. The other thing that keeps light in the pipes is the structure of the cable, which is made up of two separate parts. The main part of the cable in the middle is called the core, and that's the bit light travels through. Wrapped out the outside of the core is another layer of glass called the cladding. The cladding's job is to keep the light signals in the core. It can do this because it is made of the different type of the glass to the core. So here's the type of fiber optic cable, which is single mode fiber and multi-mode fiber. Single mode fiber is the simplest structure. It contains a very thin core and all signals travel straight down the middle without bouncing off the edge. Single mode fiber optic also used for CATV, internet and telephone applications where the signals are carried by single mode fibers wrapped into a bundle. Multi-mode fiber is the other type of fiber optic cable. It is about 10 times larger than a single mode cable. The light beams can travel through the core by following a variety of different paths or in multiple different modes. This cable type can only send data over short distances. Therefore, they are used among other applications for interconnecting computer networks.
For advantage and disadvantage about fiber optic. Fiber optic cable are used mainly for their advantage over copper cables. Advantage include the flowing light can travel further without needing as much of a signal boost. They are less susceptible to interference, such as electromagnetic interference. They can be submerged in water. Fiber optic cables are stronger, thinner, and lighter than copper wire cables. However, it is important to note that fiber optic do have disadvantage. Fiber optic is often more expensive than copper wire. Glass fiber requires more protection within an outer cable than copper. Go to the next slide. Fiber optic is frequently used in a variety of medical instruments to provide precisely illumination. It is also increasingly enabled biomedical sensors that aid in minimally invasive medical procedures. Because optical fiber is not subject to electromagnetic interference, it is ideal for various tests like MRI scan. Other medical applications for fiber optic include endoscopy, CT scan, surgical instruments like fiber laser, and density. For endoscopy, an endoscopy is a minimally invasive medical procedure used to examine the internal structure of the body closely. The procedure about endoscopy involves the insertion of a long thin tube called endoscope into the body. Then, the endoscope has a light source and a camera at a tip, allowing the visualization of organs and tissue. Image or video captured by the camera are displayed on a monitor for the healthcare provider to access. The function of endoscope. Many endoscopes are equipped with special channels, enabling the insertion of additional instruments. These instruments can be used for various purposes, such as tissue sampling or performing surgical procedures. The advantage about endoscope. Minimally invasive nature reduce the need for aggressive incision, leading to faster recovery time and decreased risk of complications. They also provide detailed and real-time visualization, aiding in accurate diagnosis and treatment planning. Did you know that endoscope has two types, which is flexible endoscope and surgical endoscope? How does endoscope work? I tell you guys. Endoscope is a flexible tube with a camera and light at one end, used to access fitness area of the body, such as certain part of the larynx, by turning the angulation from the belly section at the distal and bend horizontally and vertically. The endoscope also contains buttons for feeding air or water and for applying section. For application in CT scan, optical fiber is essential component in CT scan, facilitating the transmission of light within the machine. For procedure overview about CT scan, during a CT scan, the patient lies on a bed that slowly moves through the gantry while the X-ray tube process around the patient, shooting narrow beams of X-ray throughout the body. The facilities of CT scan. A CT scan is a diagnostic imaging procedure that uses a combination of X-ray and computer technology to produce image of the inside of the body. The advantage of optical fiber in CT scan can high image resolution. Optical fiber ensures sharp and clear image crucial for accurate diagnosis. Flexibility. They allow for the positioning of imaging components, optimizing the scanning process. How CT scan work? For assessing X-ray source, unlike conventional X-ray, which is use a fixed X-ray tube, CT scan employ a motorized X-ray source that rotates around a gantry. This gantry is shaped like a donut and has a circular opening, which is the patient part. For digital X-ray detector, instead of film scanner use digital X-ray detector, press opposite the X-ray source. This detector captures the X-ray as they pass through the patient and transmit the data to computer.
This is the third application of optical fiber in medical treatment. So you guys must wondering how does it work, right? Okay, fiber lasers use palm light from what is called laser diodes. These diodes emit light that is sent into the fiber optic cable. Optical components located in the cable are then used to generate a specific wavelength and amplify it. Finally, the resulting laser beam is shaped and released. Let's move to the function of fiber optic cable. Fiber optic cable, it can heal wounds because minimally invasive surgery comes with far less pain, faster recovery, and a lower risk of infection. Second, some carry light into the body and some carry light reflected off in internal body surfaces. Backup can make doctors diagnose and perform surgery. Third, it can cutting or cauterizing because the fiber shards are a real danger. They are sharp, more or less invisible, basically don't degrade, and will inevitably end up in someone's skin or worse, their diagnosis tract. The advantage of using a fiber optic cable is the injury risk can be reduced by avoiding direct contact to materials overlying the patient. Second, it can be inserted inside the body to produce an image in the body's patient. This allows the doctor to see an image of the inside of the body clearly and help them diagnose disease like cancer or see what they are doing during keyhole surgery. Last but not least, it also can eliminate human error in surgery. For the advantage, fiber optic cable is more expensive for patients because the materials used in the cable jacket are usually the most expensive component. Second, fiber optic cable also has higher forces during the cutting cycle. Last but not least, fiber optic cable is not ideal for higher energy parts.
In this part, we are going to explore how optical fiber technology is transforming the field of dentistry. Optical fibers have revolutionized various industries, and their impact on dental practices is truly remarkable. Many studies aim to improve dental diagnosis using high-resolution optical methods that offer real-time image acquisition. Optical fibers enhance diagnostic procedures and treatment outcomes, playing a crucial role in modern dental practice. They enable precise imaging and accurate diagnosis, which improves the efficiency and effectiveness of dental treatments. So, one of the key applications of optical fibers in dentistry is in fiber optic handpieces. These tools are designed to provide high quality, comfortable, and safe dental treatment experience for patients. Equipped with a fiber optic LED light that shines directly on the preparation side, these handpieces tremendously improve visibility for the dentist, leading to better performance and more safety for patients. The fiber optic LED light provides a clear view of the treatment area, allowing for more precise work. Additionally, the improved visibility and reduced noise and vibration of fiber optic handpieces make them more comfortable to use for dentists, reducing operator stress and fatigue. Optical coherence tomography, or OCT, is a non-invasive imaging technique that uses light waves to take cross-sectional images of tissues. Similar to ultrasound imaging, which uses sound wave, OCT uses light to capture detailed image beneath the surface of tissues. This technology allows us to see below the surface of the teeth and gums without the need for X-rays or other potentially harmful imaging techniques. In dentistry, OCT provides high-resolution imaging of gums and internal tooth structures. This advanced imaging capability makes OCT invaluable for diagnosing a range of dental conditions. It is particularly useful for identifying dental caries, cracks in teeth, assessing the integrity of recent repairs, and even detecting oral cancer. One of the most significant advantages of OCT is its safety. OCT offers the ability to see below the surface of the teeth and gums without the need for X-ray or other potentially harmful imaging techniques, which making it a safer option. So, this picture is the components inside the OCT which contain optical fiber. In conclusion, optical fibers are at the forefront of driving innovation in medical, offering unparalleled benefits in precision diagnostics, minimally invasive procedures, targeted therapy, and medical sensing. From the use of optical coherence tomography for precise imaging in dentistry to fiber optic handpieces, improving visibility and comfort during dental procedures, optical fibers are revolutionizing patient care across various medical fields. Looking ahead, the future of healthcare holds immense promise with continued advancement in optical fiber technology. This advancement paved the way for enhanced patient care and improved treatment outcomes. As we integrate optical fibers into medical practice, we can expect to see even greater strides in diagnosis accuracy, treatment effectiveness, and patient comfort. Moreover, optical fibers enhance clinical outcomes and patient experience by providing less invasive, comfortable treatment options. This leads to higher patient satisfaction and compliance, ultimately improving overall healthcare delivery. That's all from us. Thank you for lending your ears.